Welcome to the deep dive. Today we're tackling a topic that might not be top of mind for everyone, but it's actually pretty common in the animal world: hyperlipidemia.
Right.
Okay, so what is that in simple terms?
Well, it just means there's a higher than normal amount of fat, lipids in the blood.
Okay.
And this is specifically in an animal that's been fasting for, say, over 12 hours.
Mm-hmm.
We're talking high cholesterol, high triglycerides, or sometimes both.
Got it. Fasting is key there.
Absolutely. And sometimes, when these levels get really high, you can actually see it.
See it in the blood.
Yeah. If you let a blood sample settle, the serum, the liquid part,
Yeah.
might look cloudy.
Oh, wow.
We call that lipemia. It usually happens when triglycerides get above maybe 200 milligrams per deciliter.
Okay.
And if they climb even higher, like over 1,000, then the blood can look really milky. That's called lactescence.
Milky blood. That's quite an image.
It really is. It's a very striking visual cue.
So our mission today in this deep dive is to really get into what causes these high fat levels in animals, why it actually matters, and what we can do about it. We're pulling from veterinary research here.
Right.
And honestly, even if you don't work with animals, stick around, because understanding these, metabolic things can give you some real aha moments about health in general.
Definitely. So to sort of break it down, it helps to think about hyperlipidemia in two main buckets, two categories.
Okay.
We've got primary and secondary hyperlipidemia. That gives us a roadmap, really.
All right, let's start with primary then. What's the deal with that one?
So primary hyperlipidemia basically means there's some kind of fundamental problem, maybe a defect, in how that specific animal's body handles fats.
Like it's built in.
Often, yeah. We think many of these are inherited conditions. The classic example, miniature Schnauzers.
Ah, yes. I've heard about that.
We see them very often with high triglycerides.
Right.
Now, the exact genetic cause, still a bit of a mystery, surprisingly. But there's definitely a strong family link in the breed.
Yeah.
It really makes you think about, selective breeding.
Yeah, how aiming for certain traits can sometimes concentrate other less desirable genetic things.
Exactly. You get these beloved breeds, but sometimes they come with these built-in vulnerabilities.
Are there other examples of this primary type?
Sure. In cats, there's something called idiopathic hyperchylomicronemia.
Okay, that's a mouthful.
It is. But basically, it runs in cat families, and it seems to be an autosomal recessive trait.
Meaning both parents have to carry the gene?
Correct. And the defect is in an enzyme called lipoprotein lipase. Think of it like a tiny worker in the blood that breaks down fats.
Like little Pac-Men for fat.
Sort of, yeah. If those workers aren't doing their job right, the fats, especially these particles called chylomicrons, just build up.
Okay, so faulty fat choppers lead to a fat traffic jam in the blood. Makes sense. What about primary issues with cholesterol specifically?
Yeah, we see that too. Primary hypercholesterolemia. It pops up in certain dog breeds like Briards, Rough Collies, Shelties,
Oh, okay.
Dobermans, Rottweilers too. And in these guys, it's mainly the LDL cholesterol, the bad cholesterol. That's high.
So different breeds, different primary fat problems. Got it. Okay, that covers primary stuff they're kind of born with. Let's switch to secondary hyperlipidemia. What causes that?
Secondary, like the name suggests, means the high fat levels are happening because of some other health issue. It's a consequence, not the root cause itself.
Right.
And there are quite a few things that can trigger it. But first, a really crucial point is the postprandial effect.
Meaning after eating.
Exactly. After an animal eats a fatty meal, its triglycerides will normally go up for a while.
Makes sense.
Yeah, it peaks maybe 30 to 60 minutes after eating, and it can take up to 12 hours to clear.
Ah, that's why the 12-hour fast before testing is so important.
Absolutely essential. You don't want to mistake a normal response to dinner for a chronic problem.
Okay, good point. So aside from just eating, what diseases can trigger this secondary type?
Well, diabetes mellitus is a really big one.
Okay, how does that work?
In diabetic animals, you often see lower levels of that key enzyme, again, lipoprotein lipase,
The fat chopper.
the fat chopper, right? And on top of that, the liver starts making more VLDL,
VLDL.
very low density lipoprotein, another type of fat particle the liver makes. So less breakdown, more production.
It's a double whammy.
It really is.
It
Leads
leads.
to a buildup, especially of triglycerides.
Okay, diabetes. What else?
Hypothyroidism.
Mm-hmm.
An underactive thyroid gland. That's another common one.
And how does that affect fats?
Similar mechanisms, actually. Again, you can get lower lipoprotein lipase activity.
There it is again.
Yep. But also, other fat breakdown hormones might be less active, and the liver doesn't clear cholesterol as efficiently by putting it into bile. So multiple things contributing.
It's amazing how central that one enzyme seems to be. What about, say, the adrenal glands? Like Cushing's disease.
Hyperadrenocorticism? Yeah, Cushing's. That's another important cause.
Mm.
With Cushing's, the liver tends to pump out more VLDL.
More production.
And, you guessed it, lipoprotein lipase activity often goes down. So you frequently see both high cholesterol and high triglycerides with Cushing's.
Wow. Okay, so diabetes, thyroid, Cushing's. What if the liver itself isn't working right?
Good question. Liver disease, particularly cholestasis, that's when bile flow is slow or blocked, can definitely cause high cholesterol.
Because the cholesterol can't get out through the bile.
Exactly. Cholesterol is normally excreted in bile. If that pathway is blocked, it backs up into the blood.
Like a traffic jam again. Okay. What about other organs? Kidneys.
Yes, certain kidney problems too, specifically nephrotic syndrome.
What's that?
It's a condition where the kidneys leak a lot of protein into the urine. Now, the liver makes both albumin, the main protein lost, and cholesterol.
Ah.
So the thinking is maybe in response to losing all that protein, the liver just ramps up production of everything, including cholesterol. It's a bit less direct, but definitely a link.
Interesting how connected everything is. I wouldn't immediately link kidneys and cholesterol.
It shows how complex the body is. And then there's pancreatitis.
Inflammation of the pancreas.
Right. In dogs especially, we often see high triglycerides alongside pancreatitis. The cause and effect isn't always crystal clear, though.
Like, which came first?
Exactly. Is it the high fat triggering the pancreatitis or the inflammation messing with fat metabolism? It's probably a bit of both, and research is ongoing.
So a correlation, but maybe not always direct causation. Any other big factors for secondary?
Obesity. That's a huge one.
Right.
In overweight animals, the liver tends to overproduce VLDL, leading straight to higher triglycerides.
Okay.
And finally, don't forget medications. Certain drugs can cause hyperlipidemia as a side effect.
Like what?
Glucocorticoids, steroids, basically are well known for it.
Mm-hmm.
And magistral acetate, sometimes used in cats.
Okay, so that's a pretty long list of potential secondary causes. Now, if an animal does have high fat levels, what might someone actually notice? Any signs or symptoms?
Well, here's the tricky part. Often, animals can be completely asymptomatic. No signs at all.
So you wouldn't even know unless you tested?
Frequently, yes.
Yeah.
Other times, maybe if it's just related to a recent fatty meal, there might not be much besides maybe some mild tummy upset.
Okay.
But in more severe or long-standing cases, we can see things. Owners might report, say, seizures or other neurological signs, maybe signs of abdominal pain.
Which could be the pancreatitis link.
Could be, yeah, especially if triglycerides are really high.
And what about things a vet might pick up on an exam?
There are some pretty specific things to look for. One is called lipemia retinalis.
In the eyes.
Yeah, you look at the back of the eye, the retina, and the blood vessels look pale, almost milky because of the fat in the blood.
Wow.
You can also see lipemic aqueous, where the fluid in the front part of the eye looks cloudy.
Also from the fat.
Yep. And sometimes, especially in cats with that primary hyperchylomicronemia, you can see nerve problems, neuropathies, or even these little fatty deposits under the skin called cutaneous xanthomata. They look like yellowish bumps.
Huh. Xanthomata.
And in really severe cases, you might even find lipid granulomas, basically collections of immune cells reacting to fat inside organs during imaging or surgery. But those eye signs, the lipemia retinalis and aqueous, they're often quite noticeable.
Those visual signs in the eyes sound really key. So, okay, you see some signs, or maybe you're just screening. How do you actually diagnose this?
Well, the cornerstone is definitely the blood test, measuring cholesterol and triglycerides.
Right.
But like we keep saying, that 12-hour fast is absolutely non-negotiable first. Got to rule out the meal effect.
Step 1, fasting.
Step 1. Then you consider the breed. Is it a Schnauzer with high triglycerides? That immediately points towards a primary issue.
Okay.
And then you look at the whole picture. Are there other signs? Nerve problems and those skin bumps in a cat might suggest that idiopathic hyperchylomicronemia. Or are there signs pointing towards diabetes or hypothyroidism or Cushing's or liver or kidney disease? You piece it all together.
So it's detective work, not just looking at the lipid numbers.
Exactly. It's the whole clinical picture. And there are practical things in the lab, too.
Like what?
Well, very fatty lipemic blood can actually mess up some other lab tests.
Oh, interfere with results.
Yeah, and it can even cause red blood cells to break apart, hemolysis, if you leave the serum sitting on the cells too long.
Okay, good to know.
So labs have ways to handle these samples. Sometimes they spin them really fast to clear the fat. Often, it's smart to send 2 tubes, One for general tests, maybe needing clearing, and one specifically just for accurate triglyceride and cholesterol measurement.
Makes sense. Are there drugs or other things that can mess up the results besides not fasting?
Definitely. We mentioned steroids and magistral acetate can raise lipids directly,
Right.
but other drugs might interfere too, like phenytoin, prochlorperazine, some diuretics, some tranquilizers. It's always good to know the medication history. And other things can falsely raise cholesterol readings too, like jaundice, certain blood tube anticoagulants, and sometimes the lipemia itself interferes with the cholesterol test method.
So lots of variables.
There are. But the good news is, the actual methods labs use to measure lipids in animals are generally the same ones used for humans, so they're pretty reliable.
That's good. Okay, so you measure the lipids. What other standard tests help figure out those secondary causes?
Usually a vet will run a CBC, a complete blood count.
Checks the cells.
Right. And a full biochemistry profile looking at organ function, electrolytes, proteins.
Liver, kidneys, etc.
Exactly. And a urinalysis checking kidney function, looking for protein or glucose in the urine. These give you a broad overview.
And clues might pop up there.
For sure. Like a really high alkaline phosphatase, or ALP, on the biochemistry might point towards Cushing's or maybe liver issues. Mild anemia could fit with hypothyroidism.
Okay.
High blood glucose plus glucose in the urine. Classic diabetes. An elevated PLI test, that points strongly to pancreatitis.
PLI for pancreas.
Pancreatic lipase immunoreactivity, yeah. And with nephrotic syndrome, you'd expect low albumin protein on the blood work and lots of protein in the urine.
Gotcha. Are there general cutoff numbers people use?
Yeah, as a rough guide, in dogs, we usually consider triglycerides over maybe 150 milli-GDL or cholesterol over 300 elevated.
Okay.
And in cats, it's typically triglycerides over 100 and cholesterol over 200. But these are just general guidelines.
Right, need context. Are there more specialized tests beyond these basics?
Sometimes, yeah. Measuring HDL and LDL cholesterol, the good and bad, isn't as routinely done or as well understood in pets as it is in people.
Okay.
But a simple test is the chylomicron test. You take that fasted blood sample, refrigerate the serum overnight,
And look for the...
a creamy layer floating on top. If you see that, it suggests lots of chylomicrons, like in that primary condition in cats.
Neat trick.
It can be useful. Then there's lipoprotein electrophoresis, a fancier test that separates out all the different fat particles. VLDL, LDL, HDL. Gives a detailed profile.
More specific breakdown.
Right. And you can measure lipoprotein lipase activity directly.
Mm-hmm.
You give heparin the V, which releases the enzyme, and measure triglycerides before and after. If they don't drop much, suggests an LPL problem.
Okay.
And obviously, if you suspect Cushing's or hypothyroidism, you run specific hormone tests for those ACTH stim, DEX suppression tests, T4 levels, TSH, things like that.
So a pretty big diagnostic toolbox available.
Definitely. You can usually get to the bottom of it.
Okay, so let's say you've got a diagnosis. What's the treatment plan look like?
Well, first step, and often the most important, is usually diet.
Changing the food.
Exactly. We aim for diets that are really low in fat, like less than 10% fat on a dry matter basis. There are special veterinary diets designed for this.
And that alone can often fix it.
In many cases, especially if it's secondary and you're also treating the underlying cause like diabetes or hypothyroidism, yes, diet makes a huge difference.
Okay. What if diet isn't enough?
If the levels stay high despite the diet, or sometimes in those tricky primary cases, we might add medication. Gemfibrozil is one drug used to lower triglycerides. Fish oils, the omega-3 fatty acids, can also help lower triglycerides and sometimes cholesterol a bit.
Omega-3s, interesting.
Yeah. And occasionally, slow-release niacin might be considered. But the choice really depends on the specific animal, the type of hyperlipidemia, how severe it is, and what else is going on.
Right, got to tailor it. So once they're on a plan, diet, or meds, what kind of monitoring is needed, and what are the risks if it's not controlled?
Monitoring triglycerides is really key, especially if they were very high to start with. The big goal is usually to keep them below 500 milli-GDL.
Why 500?
Because levels much higher than that really increase the risk of acute pancreatitis, which can be, very serious, even fatal.
Okay, so avoiding pancreatitis is a major goal. What about cholesterol?
Monitoring cholesterol is often seen as, well, less critical in the immediate sense because high cholesterol by itself doesn't usually cause urgent clinical signs in pets like it can in humans with heart disease.
Got it. Focus on the triglycerides for immediate risk.
Mostly, yeah. But we still watch for complications. Pancreatitis and seizures are fairly common issues in miniature Schnauzers if their lipids aren't controlled.
Right, the Schnauzers again.
And in cats with that hereditary type, You can see those vantomas, the skin bumps, the lipemia retinalis in the eyes, and those neuropathies we
The
mentioned.
nerve problems.
Yeah. But the good news there is those neuropathies in cats often get much better, sometimes even resolve completely, just with a strict low-fat diet over a couple of months.
Oh, that's great news. So diet can really reverse some signs.
It absolutely can.
Okay, so let's try and wrap this up. We've covered a lot today. Hyperlipidemia in animals, high fat in the blood, it can be primary, something they're born with, or secondary, caused by another illness.
Right. Two main pathways.
There can be visible signs, especially in the eyes or skin, but often there are none. Diagnosis needs that careful fasting blood test, plus looking at the whole animal, breed, other signs.
Putting the puzzle together.
And thankfully, treatment often starts and can be really effective with just a low-fat diet, sometimes with medications added if needed. Understanding all this really shows how finely tuned metabolism is.
It really does. And recognizing these connections is crucial for vets trying to manage these cases.
Absolutely. Which leads me to our final thought for you listening. When you see how much diet and other health conditions affect fat levels in animals, well, it makes you think about us too, doesn't it?
The parallels are definitely there.
Yeah. It really highlights how important lifestyle, diet, and getting to the root cause of health issues are for all species, not just managing symptoms. Something to think about. Thanks for taking this deep dive with us today.